Dr. Rishi Desai is Chief Medical Officer at Osmosis, also a former Epidemic Intelligence Service Officer at the CDC, and he's also a doctor for Amwell. That's a U.S. telemedicine company. Doctor, thank you very much for being with us today. Why don't you talk about what the United States is doing right now? Lots of parts of the country are basically shut down. Are we doing enough?
In short, we're not. So if you look today, we have more cases in the U.S. than any other country in the world. If you look in aggregate, by this weekend, we'll have more cases than any other country has had cumulatively, including China. So we have this disease at home. This is a major front for the disease. And in terms of locking down, you just heard from your previous guest, Italy is locked down. Many parts of Europe are locked down. The United States is not locked down. And we haven't done that universally. We haven't done that federally. We've done that state by state. But the majority of states are still not locked down. And so I think we're clearly not doing enough. That's something we should have done weeks ago.
What else needs to be done? I mean, if you're looking at places like New York, New Jersey, Connecticut, Pennsylvania, California, start looking at all the states that are locked down, how long do you think those lockdowns will last in those areas?
That's a great question. So what we do is we have to look at the number of new cases per day, and it's rising, right? So it's rising day on day on day. And this is in the context of very minimal testing. I mean, even in places like New York and California, the states you just mentioned, we don't have near the number of tests that we need. We probably need on the order of 10 times more testing. So we're doing very minimal testing. We're seeing far more cases. So we need to do those two things first before we can begin to talk about how long the lockdown is going to last for. It's sort of like asking, how long should we treat for in the context of worsening symptoms day by day? So that's really not even the thought or the mindset we should have right now. We should just be thinking about full court press rather than anything else.
So what do you think when you hear the administration or others start to talk about when this is over? Could this be done by Easter?
Yeah, the person in the administration that I listen to the most closely to is Dr. Fauci. Dr. Fauci is incredibly intelligent, very thoughtful, a great leader at the moment. And when Dr. Fauci says and listens to the same thing we all do, you know, he said that timeline was very flexible. You know, he's trying to be very helpful and articulate and walking a fine balance. I think it's very clear if you hear Dr. Fauci speak about this that we need to be very aggressive with testing. We need to be very aggressive with locking more states down. And we need to think hard about getting more resources out. That's what the conversation should be about. How do we get more healthcare workers feeling safe by getting more N95s out there, by getting more healthcare workers out there in the first place? I mean, we need to raise the line to get more frontline healthcare workers out there, not talking about relaxing the lockdown.
Doctor, two questions. Would you shut down air traffic, especially out of places like New York? There are still people getting on planes, leaving hot spots like New York. We're starting to get hot spots in places like Atlanta, potentially Florida and other places. The other question really relates to this issue that you're just talking about in terms of deadlines or timelines. You know, this idea that we could have younger people or other or people who've been either immunized because they've had it before or in areas that haven't been as impacted, getting them back to work. That, by the way, you know, I talked to so many hedge fund managers who said that's what pushed the market up yesterday, this idea that we're all going back to work on April 12th, or at least a lot of the country could. Is that practical in your mind? No, not right now. So right now, your first question, do we need to shut down air traffic out of New York and other hotspots? Absolutely, yes. And everything that's non-essential to the functioning of a society needs to be shut down. That means we should keep grocery stores open, pharmacies open, fire department, police department. Those things should stay open. What needs to shut down is anything else. That's the first thing. Second thing is, you know, we say, well, there are hotspots popping up in Atlanta and other cities. Those hotspots are going to be huge tomorrow and the next day. So the numbers are very clear. This thing grows exponentially. And so even though it may not seem huge in maybe a small town out there somewhere, it will be if we don't lock it down. And so if there's talk of people going back to work and starting again, the whole idea is keep in mind the economy is suffering because we have few people out there right now working, if that makes sense. But we're going to have to lock it down for longer for every day that we delay it. So that.
Dr. Desai. Dr. Desai, I want to thank you for being with us. We'll have you back again.